A lab scientist doesn't understand how their work connects to public health. A state legislator needs to explain groundwater contamination to constituents. A community member asks what public health even does. Three professionals share how they translate this essential work into language that builds understanding and support when it matters most. You're listening to the PHEC podcast, episode 433. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to the community partners, as well as the broader communities that they serve. The support we provide often falls in categories of strategic planning and sometimes capacity building. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. This is another special conversation in our What is Public Health series, and I am very excited for you to meet my guests on this episode. Abby Tighe is Executive Director of the National Public Health Coalition and was fired from CDC in February of 2025. Megan McCarthy brings health communication expertise from maternal child health to environmental labs. Dr. Jennifer Mandelbaum serves as a New Hampshire State Representative while leading research at a health tech company. In this conversation, they explore the challenge of explaining public health when even colleagues within the field don't fully grasp its scope. They discuss why everything from septic systems to mammograms fall under public health's umbrella and how passion combined with relatable examples creates understanding across diverse audiences. Let's connect my conversation with our panel of guests right now. Welcome, all of you. I'm glad that you're here and excited to dive into our conversation. We're going to kick off with just some brief introductions. I'll go around the table, the virtual table. And I'm really excited. It's going to be a great conversation. It's just relaxing. It's the four of us sitting out at a table in a conference room, just having a conversation around a really important topic. So I'm really happy that all of you are here. So let's start with you, Megan. Why don't you introduce yourself?
Well, hello. My name is Megan McCarthy. It's an honor to be here. I'm really excited. Laura reached out. I would say my path to public health isn't very linear. It actually began in communications and storytelling. I got my bachelor's from St. John's University in Queens. I graduated in 2019, but I always had a deep desire and respect for healthcare. I think a lot of it stems from my parents working in the industry and my sister. So my senior year of college, I became a certified EMT, which I think was my first exposure to health communications and public health. I moved to DC to do a service year, which also allowed me to meet more people in the public health field. I decided to pursue a master's in public health from the University of Maryland, specifically in behavioral and community health, which really opened a lot of doors to health promotion and health communications. They have a great health literacy department there, so that was extremely valuable in my journey so far. And over the years, I've just been able to apply all these different skills in a variety of settings. I've supported maternal child health programs. I've designed digital tools for nutrition access, things like for the WIC program and SNAP benefits. And I even did a 2-year fellowship with an environmental lab in Arkansas. So it allowed me to be exposed to rural healthcare as well, which was a shock, but it's been a great learning experience too. I see just how different, but then also how many similarities there are when it comes to food access and the need for digital health resources and accessibility. So I think for me, that's what public health is really about. It's about the communication and the science. So being able to connect people to the resources and the knowledge that they need to empower themselves and then also empower their communities to live better lives.
All right, am I up next? All right. So, hi, everyone. I'm Jennifer Mandelbaum. I consider myself a public health scientist, educator, and policymaker. So, I have my doctorate in health promotion, education, and behavior. And my first real kind of big girl job in public health was working for the South Carolina Department of Public Health, which I know you know well, Dr. Huntley.
Yes.
Yeah. I worked in the Division of Diabetes and Heart Disease Management doing program evaluation work. And similar to Megan, that really opened my eyes to rural health and how distinct it is from more urban or suburban environments that I had been working in. And so I really enjoyed my time there. A lot of what I did was trying to get our research out in the community and outside of the walls of the department. So one thing that I had noticed and that my manager took an interest in too was that we would collect a lot of data, but it would just sit in computer files or in documents we would send to the CDC. But not as much of it was getting back to the communities that we worked in. So it really started this data dissemination initiative. We put more effort into one-pagers and white papers that went out to community partners. We presented at national conferences and local ones as well, published a few academic papers, and I really felt like it went to show that even though South Carolina ranks fairly low on a number of different health and social determinants of health metrics, that it's not for lack of trying. There are really dedicated, smart people who are doing the right things and just kind of butting up against structural barriers. So I currently work for a health tech company where I lead mixed methods research. So surveys and interviews and focus groups. I've been doing that for about 2 years and really enjoy it. I also teach an intro to community health class at Tufts University, which is just so fun because I have a lot of freshmen and sophomore students and they come into the class so bright-eyed and not jaded by the world yet. So it's such a privilege to be able to shape their experience in community health. And then lastly, I am a New Hampshire State Representative. So I represent 2 towns on New Hampshire's very tiny seacoast and love that it gives me an opportunity to put what I learned in school and what I've learned in my work into practice and really see that process of how an idea or evidence turns into legislation. So it's been pretty eye-opening to me.
Yeah, well, that's a wonderful introduction. And I think it's really funny. I live in South Carolina, and the whole time that she was here in South Carolina going to school, she's listened to the podcast. We exchanged, messages over social media. But it wasn't until you were back in New Hampshire and we met at a conference in person for the first time.
Yes.
All those times, and we thought we'd already met in person, but all the time that you were right here in town, and we didn't get to meet in
I
person.
know. Too funny.
It was great to have you here.
Thank
And
you.
also, Abby, please introduce yourself.
Yeah, I am Abby Tighe. I am the executive director of the National Public Health Coalition, which was formerly called Fired But Fighting. I worked at the CEC previously and was fired in February. I have a really kind of large range of public health tools that I've built up in my career. So I got my MPH in Boston, and then I have an undergraduate degree in environmental health that I got from Western Carolina University. So in a very rural area in the mountains of North Carolina. I worked at HRSA during my master's program. So I worked in Region 1 and did a lot of overdose related work and trying to help folks kind of marry funds from state and local, federal. I've worked in PR, and then at CDC, I worked in overdose prevention, specifically with community-based organizations. And since being fired, me and a whole bunch of colleagues have started this grassroots organization to try to do our part in saving public health and rebuilding public health.
Thank you, Abby. I know you said what is the new name of the coalition?
It's the National Public Health Coalition.
Okay. I want to write that down. So when we talked before, you mentioned the name was going to be changed, but that's a good update. Well, thank you all for those wonderful introductions. I appreciate all of you, all of the work that you do. And I'm excited for this conversation because I'm already starting to think about some of the questions I will want to ask a little bit later. But you all bring very different perspectives to this question even. So once again, it's the idea of us being able to demonstrate how we explain public health in plain language, and some stories will get intertwined in there. And I think all of it is wonderful. So you have some free range into how you want to respond to the question. There's no right or wrong. So that's the beauty of it. It's just a way for us to pull it all in a platform to make it easier for us to access and hear from others, and for those who are trying to pull our stories and use our stories to help advocate for public health and explain it further, to really get that community buy-in, for people to really understand the importance of the silent work that happens in the background, so that it's highly valued, more valued, and protected, from these dramatic cuts and erasures and unfortunate experience that Abby experienced a couple months, earlier this year. So let's start with you, Megan. The question is, and you'll have, a few minutes each to respond, but the question is, what is public health? Like, how do you respond to that when asked?
Yes, it's a loaded question. But I think the simple answer is everything. Public health really is the start of many different prevention and advocacy programs. But for me personally, I know I mentioned this earlier. To reiterate, I really think public health is the bridge between science and communities. It's in everything collectively that we do to help keep people and communities safer and to live healthier lives, from clean water and clean air to food access, as well as evidence-based information that we can share with the public in a way that's accessible, free of jargon, visually appealing, and also considers different mediums. So sometimes it's digital outreach like social media, or creating flyers and infographics and brochures and things that can be printed out and shared at different community health centers or clinics or schools. Public health can really be everywhere. So it's about connecting the people to the information and the systems that they could utilize to live better lives.
Thank you. That's really well said. I had to write down that bridge between science and community. I like that. Yeah, it's, we often say public health is so broad. And you said public health is everything. I definitely get that. We're going to come back to a little bit more follow-up questions for you in a moment, but I'm going to keep going around for responses. Jennifer, same question, and I'm sure that you're having to explain this in a variety of settings. You've gotten a whole lot of experience with this, but how are you explaining? How are you responding? What is public health?
Well, I like what Megan said about being a bridge between science and community. I took a slightly different route when I was trying to come up with a definition, and I'm just going to read what I wrote. So I think public health is a promise that every person, no matter who they are or where they live, deserves the full chance to live a full, healthy, and hopeful life. And I say promise because I think a lot of us got into this field thinking that we're going to make a difference at a population level. And I think sometimes that isn't so obvious, or it doesn't quite come across, or we hear about these big things that have these big accomplishments in public health, like getting seatbelt laws passed, or like the Clean Water Act. And I think we could consider all of those public health successes. But in our day-to-day lives, I think it sometimes is a little bit smaller. And it's really about connecting people to services. It's about making sure that good healthcare and all the social determinants that can affect our health, are as equitable as they can be. And then I also think that public health is a call to action, because we're really talking about protecting our shared future. This is we're all living in maybe not the same environment, but we're kind of all in this together, as hokey as I think that sounds. And I think public health, sometimes to its disadvantage, is really about thinking long term. It's that if we do something today, if we invest in healthy solutions, we might not see the effects of it tomorrow or next year, but down the line, we're going to see some major differences, positive differences in population health.
Thank you. Yeah, like I had to write down that too. Connecting people to services, great way of breaking it down. But I also like how you said it's a promise. That really resonated with me because I feel, not to get too much on a tangent right now, but I feel like we've been traumatized, those of us that do this work and this year, and it feels very, very personal. So we're going to come back to that one, that comment a little bit. Abby, I'd love to hear from you. What is public health? How are you responding to that question?
Yeah, so I think of it because of my background. I think of it from like a really broad perspective, and I often describe public health as our piece of society that we invest in for the health and wellness of our communities and our nation and our people. And I like to describe that in that we invest in our roads and making sure that they are drivable and safe. And we do a similar thing for people's health. And just like we want to prevent a car accident, so we have, good roads to drive on. We want to prevent heart attacks and diabetes and all different kinds of flu, communicable infectious diseases, like all different things that we spread between people. We invest up front to try to spare people from those consequences long term. That's my short and sweet definition. I feel like a lot of other good stuff has been said, so I don't want to, harp on it too much.
No, that's really good. I like how you use the roads analogy. And that's a lot of what I really like about the options that we have really for being able to explain in plain language. We can simply start with something very relatable, either something that personally resonates with the work that we do, or if it's like a family member, someone that we know really well, we can lean in with something that we know that they're interested in or something that they can easily relate to. And so that was a really great example. I am going to come back around to you again, Megan. I I'm going to kind of, we kind of open, no real formal structure here in terms of feedback, but both you, Jennifer, and Abby can be thinking about this. But in terms of Megan's response, I know I like that, you said public health is everything. And you also, in your introduction, you talked about your background as an MT and you've worked on a variety of programs, maternal child health, WIC, SNAP. I imagine you've been in settings and situations where you've had to connect the dots. It's probably connecting for you, but has that helped you explain to people in those settings, like what public health is, or, really demonstrate that value of public health? Because people often, I have a healthcare background too. So people often lump everything health into healthcare and not really sift out the difference. So have you had experience or situations where you've had to try to navigate that in those settings?
Yes, definitely. I mean, one particular that comes to mind, my recent fellowship with the Association of Public Health Labs, it sent me to Arkansas for 2 years, and they're called the Public Health Laboratory of Arkansas. But a lot of the scientists that I would talk to really didn't know what public health was. They were like, they would ask me because they knew I was coming in with more of a health communications background rather than a laboratory science background. And the fellowship encouraged that, but it definitely left room for growth and explanation from both sides. But I was able to definitely connect the dots to whether it was clinical testing services. There's so many different labs like newborn screening, immunology, all these scientists that are on the back end of things, processing tests, COVID tests, flu tests, and then would submit those samples back to the local health units and input the results for providers that would then explain to the patients what their results are. And I was able to say, right there is public health. You guys are the start of it. You're doing the analysis and you're getting the results. And then you're sending those results so that they can be communicated to the public so that they could make the decisions for themselves, whatever they have to do, whether it's receive treatment or do more prevention techniques to keep themselves safe, like masking up or getting vaccines and all of that good stuff that keeps our communities healthy. It's been a learning process, but I get stronger in my definition every time I have to explain it.
I love your example because I also came from a lab background and I get it. I think it's interesting because it points to, I often talk about this, our partners. So we think of immediately the community, like our neighbor, our friends, but we also forget about our coworkers and colleagues because are often siloed. So you've got people that are in healthcare or public health and they teeter the two lines and they don't understand the distinction. So and then in public health, historically, we've had these silos. So people that are, all kind of stick together and don't necessarily know what the others are doing. So you just gave a great example of how this conversational, this opportunity to explain and to educate across the lines of these silos.
Yes, absolutely.
Dr. Huntley, can I just chime in with a thought?
Yes.
Yeah, so you had mentioned, and Megan, you had talked about this, how public health is everything. And I remember, I think they still do this campaign, the Association of Schools and Programs of Public Health, ASPPH,
Yeah.
has this campaign called This is Public Health. And kind of the gist of it is that, like, yes, everything is public health. And you could request stickers that you just put on things to say your tap water is public health and
Right.
your public transit is public health. And I think I've struggled a little bit in recent years with that broader perspective. And I don't mean to, to critique that, but I think, as you were saying, Dr. Huntley, I think there are a lot of silos. And I think in public health, we're really good at identifying like what is, that healthy endpoint, like what is going to improve health outcomes, but sometimes don't consider these direct or indirect consequences to other sectors that are pretty siloed too. And I was just thinking about a conversation I had recently with someone about the COVID-19 pandemic, not to scar everyone all over again. But we were talking about how public health and like follow the science, that perspective was kind of it was kind of singularly focused on how are we going to prevent people from getting sick and dying, which I think is the most important outcome. But he also brought up that there's learning loss and schools closed and people lost their jobs and didn't necessarily have that flexibility. And I feel like sometimes we we like to think that we're considering all of these perspectives, and in practice we might not. And this is something I've talked with my students about too. In class a few weeks ago, we talked about, like, is this thing public health or is it not? And really we saw that some of those social determinants were things that people were like, well, we can see that affecting health, but, like, is it public health?
Mm-hmm. Yeah. I think that's really interesting. I'm curious, Abby, do you have anything to add on that?
Yeah, my approach tends to be quite simplistic. And so I think that when I talk about public health versus healthcare, and the way that I like to describe it is that public health is this like really big, giant thing, and healthcare is one piece of it. But like, just to show how broad it is, public health includes the man or woman who installs your septic system at your house. It also includes your doctor that's giving you a mammogram. And it includes, the person who is putting your well in your, like, for your home in the mountains. Like, all of these things impact your long-term health outcomes, and really bringing it back to like how individuals and communities operate within their society and what they, directly interact with. Those things often have some level of tie to public health. I tend to keep it broad because I think that while everything is not maybe technically public health, it might be housing is not technically public health, but we know that there are really significant issues for your health if you don't have access to housing. And so I think that there is room to have this really broad definition where we talk about the nuance. And I know we say that the public doesn't like to take nuance, but I think we are selling ourselves short if we feel like we can't dive into the nuance of public health with people. It assumes that they're unwilling to engage with us. And I think that operating from that assumption is part of who.
It's a really good point. So, what I'm picking up from both of you, really all three of you, is, there's opportunities to And I love that they do still have the This is Public Health, because there are some ambassadors that I've brought onto the series to talk about what is public health. But I do think instead of maybe just tagging This is Public Health, connecting the dots with that story, like those little nuance differences. I find I've been guilty of assuming someone didn't want to hear my rambling story. And then those moments when I do share that little connecting the dots story, it's more ah, like an aha for them, and it sticks, and it's like now, thanks for sharing that little detail, because now it makes sense. So I really rarely regret the times that I connect the dots with those little stories, especially in those moments of whether it's a family or a friend. Sometimes it's a stranger that's just open for the conversation. But I think that, to your point, Abby, that's a lot of, and Jennifer, like a lot of opportunity to connect that and just kind of go ahead and turn the light on all the way instead of tagging it and leaving for them to draw conclusions.
And can I just add that I think that passion that comes through in that storytelling is just as important, especially when we are at this period in time where you have leaders of this country that are trying to argue that people who work in public health or in the medical space are not in it for good reasons. And I think when you talk to people and you really hear the passion behind the work and behind the stories, it helps counter that narrative in a really nice way.
Yeah, I agree. Feel like you have something to add to that, Megan.
I'm very passionate as well. I agree. And I do want to say too, I follow Abby's Fired, the platform so it's really cool to get to meet you and hear about your experiences too, because I know a lot of people from my program that post PhD candidates that were working in government positions and doing such great things. And I know are such passionate people that have gotten let go. And it's just been devastating to see unfold. So, but I have hope, and I know a lot of other people have hope too. I mean, no one goes into this field thinking it's going to be easy. So it's going to take a lot to bring us down.
Yeah, I like that too. I think that's where, really this whole concept and this series was born as a way to pour the passion into and the opportunity to leverage this platform and share and let a lot of you share and your thoughts. And it's exciting for me. I get to do this over and over and over. and and I really enjoy that, hearing from everyone and seeing people light up when they get to speak about the thing or the area that, shared their story, or the bit that sometimes it's remembering what brought them here to begin with, and the vision for what's to come and what it's going to become, and being a part of rebuilding something better than what we had before. Jennifer, I would love to, and I'm going to be conscious of time because we could probably talk about this for a very I'm going to go back to when you mentioned the promise, because I think that's where that passion, that fire kind of lights up.
Mm-hmm.
We did, all of us in public health, we really got into this work because of a vision of something better. We envision better health. Sometimes it was born of our own lived experiences, or, watching family members suffer and then wanting to make that better for others. But that promise of being able to have an impact, and a positive impact on communities that we care about, and, advancing public health. We all are very driven by that. So is there something about, as we talk about public health and we share our stories and really work to put aside the jargon and explain things? And I was just kind of funny. I went to a lot of conferences over the last few months, but I was at one in particular where it was just a bunch of like foundation leaders and academic people, and at the very beginning, like, you have to check your jargon at the door. So they did not allow any acronyms. And that was the funniest experience, because people were realizing just how loaded they are with all the acronyms. But being able to kind of put that aside and really being able to explain. I'm just wondering, thinking about the work that you do as a representative, as a state representative, not only is, I'm sure it's very challenging, but how are you incorporating and balancing this part of the journey where you're trying to explain and have the hope and hold on to the promise and inspire people and connect people to public health? Like, how does that look for you?
It's a great question. I think my approach to health policy is kind of smaller incremental steps. And I think sometimes the New Hampshire legislature is very split And I think sometimes that's just the way you have to do things when you're in the minority party. So sometimes it's a bit of a piecemeal process. I live in an area where our groundwater is just filled with PFAS. And if it's in the water, it's in the air and the soil. And so I worked with a few legislators in the last year and a half to move forward some legislation around banning certain products with intentionally added PFAS. But we've done that in small steps. So, for instance, instead of just saying a blanket, no products with intentionally added PFAS, we passed a bill last year that was around like boating products. So it's just little steps at a time to try to get things done. And I think I I feel like sometimes that goes over a little bit easier than saying we want to rework this whole system and then people wonder what's going to happen, and just kind of bringing it down to a more human level that this is the issue we're facing. Here's what we're doing about it. And this is what we hope comes of that, without getting too in the weeds. And I know Dr. Huntley and you and Abby were talking about those nuanced stories, but in my role in the state legislature, I'm not sure how much of that nuance comes through. So I tend to focus on more like discrete outcomes.
Yeah, that's fair. I think sometimes, I'm thinking like baby steps, but, really chunking it down is what has gotten me through the last several months, really. Sometimes it's whatever it is, I have to break it down into something manageable. I can't look too far ahead because anxiety goes too high.
Yeah.
And I have to look a little past where I am right now. So I find just that little bit, like sometimes if it's, I'm just going to focus on the morning, I'm going to get to lunchtime. Don't
Yeah.
My husband would ask me he would always ask, "What do you want to do for dinner?" He's asking me in the morning. Now he's trying to plan and be helpful, but I'm thinking
Right.
that's so overwhelming. I can't think about dinner. I'm just trying to get through the
Yeah.
morning. So like
Yeah.
these little small steps.
Yeah. And I think too, I sometimes feel a little disheartened that we in public health sometimes take these smaller, more incremental steps when we are seeing mass layoffs and a complete 180 on some of our national public health policies. So sometimes I think, what are these little things doing? But at least from my position, that's what I can do.
Yeah. There's a lot to unpack there, but I think it's just a matter of we do what we can do. We don't have to solve the whole big problem. It's a big, massive issue that not one single person caused. So not one single person is going to be able to fix that, but we do what we can do. And collectively, it's, I think, the effort there that
Mhm.
gets us going. Megan, I know that you're not necessarily early in your career. You've got some traction going here, maybe mid-career, I would say, based on just listening to you. But how does communicating, like what we're talking about today, being able to communicate plain language, having these opportunities to, get a little bit more buy-in, how does that sit with you? How does that feel for you?
It feels natural. I think that the creative aspect of health promotion comes very naturally to me. But over the past few years, I've been really able to hone my skills on the scientific education and knowledge. So I'm doing a certificate program in environmental health right now, and it's only 4 classes, but it's a great opportunity to gain more knowledge and expertise in scientific research, and then communicate it in ways that I already know how and have been able to hone my skills in the past few years to anyone that's willing to listen and engage with me. I think the growth of AI and everything we're seeing in the digital world, it expands so rapidly that it's not always easy to predict what platform might be the best for communicating with the public. But a solution to that is just making sure that I'm staying curious and talking to my network and understanding my target audience. And so in a way that so I can resonate with them and communicate all these various health topics that I think are so important. And then just making sure that I'm always reminding myself about the health literacy techniques, avoiding jargon, using accessible fonts and color schemes, considering people that might be colorblind and considering older populations that might not be on social media and they're embarrassed to say that they're not as tech savvy, but their health promotion needs are just as important as younger generations as well. So Always trying to be considerate.
I'm going to tell you this in case someone has ever mentioned this, but you have a superpower of your blended background, that interdisciplinary folk. I mean, you're coming from background of EMT with that expertise and that lens that you're able to use. Even you mentioned, WIC, SNAP, rural health. That's a really, that gives you a very unique filter, and that's definitely a strength. So we need you to keep going strong. We need people that are interested and really driven to do this work to keep thriving. So know that.
Yeah, I appreciate that. And I'm looking for my next home and career path right now. I'm back in New York, and it's good to be back in a state too that I think maybe aligns more with my values. So I'm hopeful that it'll lead to something where I can continue to grow and educate others.
Yeah, absolutely. I know we've gone a little longer than I thought, but we have to begin to wrap up here. If you all have any final thoughts you'd like to share, I'd love to kind of hear a brief update with Abby and from you about the National Public Health Coalition. If there's something we can do to support, or just let us know where you are.
Yeah, I can give you an update. I did want to chime in just one thing. Jennifer was talking about PFAS and about incremental change, and I think one of the things that we've been talking a lot about is everyone wants the same thing. We all want to live in a healthy, safe community with access to food and access to activities that we like to do and to education. Like, we all want to live in this perfect society. Who wouldn't want that? It's the methodology of how we get there that we have to discuss and be willing to make compromises on. And to, sometimes admit that public health may not be right about how to approach something. And that's okay. That doesn't negate everything that public health does. And so I think going into conversations, one, establishing the shared goals that I think are really there. And then also being ready to be humble and be humbled a little bit to make progress. So that's something that I think dovetails with what Jennifer's kind of doing in her day-to-day approach as a policymaker, and something we're thinking a lot about. But the update on us is that we are officially the National Public Health Coalition. I might have mentioned this in our previous discussion, but I am a firm believer that public health is political because we rely on policy. It is not partisan. And so what we're trying to do partially through this name change is to recognize that we want a nonpartisan approach to public health. But that doesn't mean that we aren't political and aren't supporting policies or thinking about policies and trying to separate those two things. So we got feedback from Republicans, including former Surgeon General Jerome Adams, who told us he really liked our work, but that our name was not going to get us in the door with people who care about the same thing, but see the name and immediately shut down. And so part of that change is we want to be really inclusive and make sure people understand that this is for everyone. Public health is for everyone. And this advocacy work is for the people. It's not for the institution. It's for the people. And also, we wanted to make sure folks who hadn't been fired and who really just cared about public health and wanted to participate knew that we have an open door policy and we welcome all folks who want to, help in this mission. So we'll be at APHA next week. We did a really cool Hill Day in DC where we talked to representatives across the board and got to advocate we focused specifically on CDC funding, just because that's kind of where our expertise is right now. But we're really hoping to kind of grow and expand. I've offhandedly said we want to be the NRA for public health. The NRA gets to advocate on behalf of the Second Amendment. So why can't someone advocate on behalf of people's health in a really broad sense, and not healthcare, but how do we make sure people have access to the things that they need to live a healthy life? So we're really in the forming process of that and getting ready to fundraise. So any connections to help fundraising would be really cool because I don't know what I'm doing. I've never done this before. And yeah, we have really cool swag if people want to buy things. This says, don't take medical advice from me. And it's a little worm. If you know, you know. And we have more subtle swag as well. But yeah, we're really growing and trying to find our fit in this larger kind of public health advocacy world and really hoping to make a difference. But yeah, we'll see.
Wonderful. Well, thank you so much for that update. I'm excited. This has been fantastic. Thank you all for all of your contributions to this conversation. This has been very insightful, and a lot of great examples, very inspiring. Any final words before we go?
Talk to your state representatives. I think we could talk about any number of issues that have been kind of transferred from the federal government to state government, and that's what your state representatives are here to do. So in New Hampshire, it's kind of a unique situation. We have a lot of representation. There are 400 members. We represent on average about 3,500 people. If you live elsewhere, your representatives, I almost guarantee you represent more than we do, but just reach out. It doesn't have to be a formal thing. You don't have to share a policy brief, and not to speak for everyone, but mostly we want to hear from you.
Yeah, that's a great reminder. Thank you for sharing that.
Yeah, the last thing I'd say is similar, just to stay educated, stay curious. I think that education is the best way, the key to prevention. So when you learn something that inspires you, you can then share that maybe at a dinner table or with a couple friends who might go on to share that with someone else. So it's really about collaboration and learning through others as well.
Yeah, thank you. This has been great. Thank you all again for being here, and I look forward to keeping in touch.
Thank you so much.
Thank you so much. It's so nice to meet you, Abby and Megan.
Yes,
Yeah.
you too.
No, so much for the opportunity.
I really hope you enjoyed that conversation as much as we did. This conversation reveals that explaining public health effectively isn't about perfecting an elevator pitch. It's about meeting people where they are with stories that connect the work to what they already care about, whether that's safe drinking water, preventing disease, or ensuring communities can thrive. When public health faces existential threats, the professionals doing this work every day become its most powerful advocates. Their ability to translate complex systems into relatable examples, combine scientific rigor with genuine passion, and stay committed to incremental progress builds the public understanding that protects this essential field for the long term. I encourage you to connect with Abby, Jennifer, and Megan and learn more about the great work that they're doing. You can find links to connect with them on the show notes page. The show notes page for this episode, which is episode 433, can be found at phecpodcast.com. Once you're there, just navigate to episode 433 to find the show notes. One more thing before we go. Remember that our podcast has an app and a private community where you can engage with public health professionals around the world. You can download the PHEC Podcast Community app in your mobile app store, and it's available both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.